medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi. If you watched the first two parts, which you should have prior to watching this one on testosterone, you might at this point be slightly confused. I am too sometimes. So let's clear up an important point about testosterone before we go any further today. Using symptoms of its deficiency, testosterone that is, may or may not be overly helpful. Testosterone levels can be high and the persons can still be quite functional, but it can be low as well, and the libido can also be low. Vice versa is also true. So the number of testosterone may not fit that history picture. Now remember, the outcome depends also on the ARs, the androgen receptors. One more important point you should know is that there has been found in several studies a significant intra-individual variability, which you have to take into account when you're interpreting the statistical values that are being presented to you and what you're seeing in your patients. Several studies have noted that fluctuations in testosterone values obtained in the same person at similar points in time, in 2 separate days even, the values can vary as much as 32%, and that's considered an absolute statistical variation. That's a lot when you consider the numbers. Now, the current Endocrine Society guidelines pretty much recommend free testosterone in men with low normal testosterone levels, in whom sex hormone binding globulin, SHBG, alterations are suspected with low values established within each laboratory. Free testosterone is also a better indicator in young males as opposed to the elderly. And that suggests that age-associated increase in sex hormone binding globulin may further reduce, of course, the specificity of the free testosterone. Confusing again. Recognize that these findings and studies which utilize total testosterone to diagnose hypogonadism should not necessarily be extrapolated to suggest that similar results can be expected using specific free testosterone thresholds and vice versa. Now, lower testosterone levels, 216 to 346 nanograms per deciliter, free testosterone was shown to be superior to total testosterone. That suggests that total testosterone may be a better indicator of hypogonadism in cases of borderline low testosterone, where calculated free testosterone and bioavailable may help to diagnose and make the diagnosis for you. Now, bioavailability is non-sex hormone binding that is bound to the testosterone. So, in my opinion, a full complement of measurements to make the correct diagnosis and therefore make a proper protocol makes sense in the development of an individual's program. A good history? Absolutely. A full hormone panel is essential. I mean, testosterone total and free, estradiol, progesterone, sex hormone binding globulin, and yes, even dihydroepiandrosterone, pregnenolone, and you should also assay for IGF-1. What does this all mean? Well, the final installment of the series, part 4, is going to consider the treatment alternatives and options. I'm Dr. Mitch, and for more information, please go to Dr. Mitch Ghen, DrMitchGhen.com. Thank you so much for watching.